Of course, right now I'm smiling because it is my distinct pleasure to introduce our President-elect, Karen McQuillan. Karen completed her pre-nursing degree at the University of Maryland in College Park and earned her Bachelor of Science in Nursing from the University of Maryland, Baltimore. Woo! After a few years as a staff nurse in the medical surgical ICU at Doctors Hospital of Prince George's County, Karen wanted to increase her knowledge in critical care nursing. She returned to the University of Maryland School of Nursing, earning a Master of Science in Trauma Critical Care Nursing. For the past 28 years, Karen has served as a clinical nurse specialist at R. Adams Cowley Shock Trauma Center at the University of Maryland Medical Center, where she has been the lead CNS in the Shock Trauma Center and the Emergency Department for the past 2 years. Karen, who holds a faculty associate position with the University of Maryland School of Nursing, Baltimore, has lectured on neurological and trauma topics at numerous conferences. She has served as an investigator on many studies exploring trauma nursing care and is well published on neurological and trauma topics. She works to foster improvements in trauma care around the world in countries like India and Brazil and has received numerous honors for her work. A proud member of AACN's Chesapeake Bay chapter since 1987, Karen has chaired the NTI Planning Committee and served on the Evidence-Based Practice Resource Group, Continuing Education Review Panel, and NTI Evaluation Team. After 3 years as a director on the AACN board and consecutive 2-year terms as a director on the AACN Certification Corporation board, she now serves as president-elect. Karen thanks her wonderful parents, her best friend and husband, Bobby, Megan, and Robert for providing love and support throughout her career. She also credits numerous mentors, including Trish Morton, Dory Fontaine, Connie Wallach, and Karen Doyle, with offering countless opportunities to step forward and lead. She cherishes her colleagues at the R. Adams Cowley Shock Trauma Center and considers them role models for driving excellence in patient and family care. I am pleased to pass the baton to such an accomplished and admired successor. Please help me in welcoming my friend and colleague, Karen McQuillan.
Good morning. It is wonderful to be here with you this morning. Are you enjoying NTI? Good, me too. Let's have some fun. I want to tell you about a good luck charm. It hangs in the corner of my kitchen next to the microwave. I bet you can't guess what it is. It's a kitchen witch. Have you ever heard of one? When I got her, I was told the witch would bring me good luck. She's been hanging in my kitchen for nearly 34 years, and the years have taken a toll. She now has burn spots on her shirt, and there are a few grease stains on her skirt. But the witch doesn't hang there because I think she's beautiful. She doesn't even hang there because I believe she will bring me good luck. In fact, I know she won't bring me good luck. It's been 34 years and my cooking hasn't improved one bit. My husband can vouch for that. So why do I keep her? She hangs there because she was a gift from Tony. Tony had Guillain-Barré, and I had spent months caring for him. He was completely dependent on me and the care team. When he was finally discharged from the ICU, Tony gave me the kitchen witch as a special thank you. I felt good that I could make a difference in Tony's life. And every time I look at that witch, She reminds me of why I became a nurse. As nurses, we have the incredible privilege and responsibility to provide care for our patients, the sickest and most vulnerable in healthcare. Care isn't just an effort made to do something correctly, safely, or without causing damage. That's what the dictionary says. No, care is something much, much more important. Does anyone remember the television series Cheers? Well, there was one scene where Norm walks in and someone asks him, "How's life?" And Norm says, "Not for the squeamish." That's kind of how I feel about care and about nursing. Jean Watson tells us caring is the essence of nursing. But nursing care is also something that's not easy or for the squeamish, and certainly not for those without courage. Think about it. As nurses, we have the unique ability to improve our patient's physiologic condition, to foster healing, to inspire hope, to calm fear, to alleviate pain, to help people learn, to comfort people who grieve. We have the unique ability to make a lasting difference in the lives of our patients and their families. Our care is powerful. Our care is bold. It is resolute, at times difficult, and yet it is gratifying. And it takes tremendous courage to deliver. I don't want us to ever lose sight of our power and the triumph that comes with our unique practice. Our theme is here to tell us, as John F. Kennedy said, that courage is the most admirable of virtues. It's here to remind us of the strength that is in each of us. So I'm really excited to tell you that our theme for the coming year is courageous care. Winston Churchill called courage the first of human qualities because it is the quality which guarantees all others. We're not born with courage, but we can develop it. Franklin Delano Roosevelt said, "Courage is not the absence of fear, but rather the assessment that something else is more important than fear." What courage really means is that we face our fears to do what we know is right, even when it's not easy, especially when it's not easy. For us as nurses, courageous care means doing what is necessary to provide the best possible care for our patients and their families, period. So are you up for a challenge? Good. I challenge us to show the world that we as nurses don't just provide care for people. We tend to the needs of patients and their families at the most vulnerable time of their lives. We work to reshape the very face of healthcare and to reimagine the way healthcare is delivered. And we do it while consistently named the #1 most trusted profession in America. Some people think of caring as holding a person's hand or comforting them. As important as that is, it doesn't speak to the full power of the care we provide. Nursing is unique. Do you think the average person realizes how much courage it takes to care for our patients? Do they know the strength it takes to comfort a son when his mother is in a coma? Or to calm a patient who thrashes wildly and pulls out an IV? I can hear some people say the word caring is too soft and mushy. So let me ask you, is it soft to do whatever it takes to provide exceptional care, knowing that despite your best efforts, your patient might not survive? Is it soft to help parents cope with the fact their child will never be the same after a severe anoxic event? Is it mushy to be the person families rely on when making end-of-life decisions for a loved one who will be forever dependent on life support? I don't think so. We nurses show courage daily. We demonstrate courageous care each time we step up to advocate for our patients or challenge the way we've always done things. We demonstrate courageous care when we say we don't understand something and then go learn about it in order to gain the knowledge to care for complex patients. We demonstrate courageous care when we have a difficult conversation with a colleague who's lost their passion for nursing. We demonstrate courageous care when we recognize our own needs and take the time to renew and recharge ourselves. Remember Brene Brown from last year's NTI? She's an expert on courage, and she tells us courage is contagious. I believe that. We take advantage of sharing our experiences and being role models to strengthen delivery of courageous care by others. We can seize the opportunity to develop other nurses and assist them in navigating their journey. When we do this, we help cultivate courage in others by inspiring them to face their fears and take on new challenges, like caring for more complex patients, like getting certified, like confronting a breach in practice that a colleague has performed, like giving a presentation or publishing an article, or leading a change in practice that profoundly improves patient outcomes, or simply by assuring them that we will serve as their mentor and that we have their back while they take on a new role or challenge. All of that, what we do every day, is the essence of courageous care. This is a tumultuous time in healthcare. It's been said, if we don't drive change, change will drive us. And change is rapid and rampant. Who better to drive the needed changes in healthcare than us? Who has a more expansive knowledge of healthcare than we do? We are in the trenches delivering courageous care 24/7. We are leaders who make a positive difference regardless of our position or title. We are the designers of our future. We must steer healthcare in the right direction. If we don't, someone else will. Whether we are at the patient's bedside, in the classroom, or in the boardroom, it's our courage that will drive us to lead the changes needed to provide optimal patient care. It's our courage that will ensure the outcomes we know are possible. It's our courage that empowers us to learn and use skilled communication. It's our courage that compels us to insist on true interdisciplinary collaboration. We know when we are engaged, we can move mountains. As TK said on Monday, we can move heaven and earth. But we have to be careful that we don't burn ourselves out, because healthcare settings are breeding grounds for compassion fatigue, moral distress, and burnout. Research shows that nurses are vulnerable to all these phenomena, but studies to develop interventions that foster resilience among nurses are also underway. The old adage rings true: you can't care for others if you don't care for yourself. An important aspect of being resilient is being courageous in seeking out activities that help us renew and asking for support when we need it. Not always intuitive or easy, but essential for those of us who care for others. Sometimes this is revealed to us in powerful ways, let me tell you about a time that happened to me. My son Robert is an avid skateboarder, and he's good. I also have to tell you a little something about myself. Well, I participate in the sport of curling. That's right. Brooms, stones, ice, the whole bit. I know it's hard to believe. Or as my husband calls it, the sport that looks like you're scrubbing the floor. Well, one thing curling doesn't require is a helmet. Now, because my sport doesn't require a helmet, Robert, despite my pleas to the contrary, assumed he didn't have to wear a helmet while skateboarding either. You know how teenagers can be. Anyway, one day, a young patient was admitted to our trauma center. He was skateboarding, and his legs went out from under him. He smacked his head on the ground and suffered a severe traumatic brain injury. He would never be the same. And then I realized the patient and my son were about the same age. That made him someone that I completely and personally connected with. I literally stopped for a second and went, wow, that could have been my son. It's times like these when you pause and realize the impact your work has on your life. There are no elective injuries in the trauma unit. Every patient in there never imagined this was going to happen to them. Yet here they are. So that changes how I think about my life. I realize the need to take time for myself and my family, to recharge, to refresh myself. I also think I've got to do the things that are important to me now. We need to constantly restore our spirits to enable us to do the challenging work we do. It's vitally important for us to define nursing so others understand it the way we do. To me, it's a unique blending of art and science. It's something we should be incredibly proud of. It's almost a sacred thing. That's why I am humbled to have the honor of serving as your president for the next year. And when I say serving, I mean just that. I am here to serve you courageously and in a caring way. I ask you to join me on a journey of courageous care. I want to get to know you and your stories. I want to know when you have been dynamic and bold, but I also want to know when you've been tired and uninspired and less than courageous. It happens to all of us. So I told you about my son. I should also tell you about my daughter. She has one of the greatest jobs in the world. She's a pediatric ICU nurse. I am so proud of her. She calls me after work almost every day, and not just on the joyful ones, but on the tough ones too. I remind her that part of nursing is recognizing not every day is great. Some days are incredibly tough. So I say to her, learn from the bad days. Find the joy in the patient experiences that energize you. In fact, if you can, dwell on the joyful moments with patients and their families. This is what will refresh and restore you. It is also what makes it possible to provide courageous care to others. That's just Megan and me talking, two nurses supporting each other. Now here we are, nearly 8,000 nurses together. Being in the presence of this many nurses is another way we build our courage. So for the rest of this NTI, let's take time to share stories with each other. Let's talk about how courageous care contributes to creating a legacy of making a meaningful difference in the lives of others. I want to hear those stories too. Would you please email me, and while you're at it, let me know if you have a kitchen witch. Okay, maybe not a kitchen witch, but some other memento or symbol you keep of that one special patient you cared for. Let me know how your courageous care made a difference in the life of a patient and their family. We cherish those stories, don't we? They remind us that we are exceptional nurses, that we do what's best for our patients and their families, that we strive for excellence in all we do. And every day, we see things that would make the rest of the world flinch, but we don't. We don't because we know it is a privilege and an honor to perform the greatest job in the world with compassion, conviction, and above all else, courage. Thank you.